shutdown or no shutdown, the first phase of Obamacare just went live today, and while you can't get actual coverage until 2014, today marked the first day Americans could go online to sign up, or at least try to sign up, because there's been more than a few kinks reported in the rollout of the newly minted Obamacare website, healthcare.gov, and several of the state pages it links to. And by kinks, I mean error messages like this one that stared down some users this morning trying to log on to the new site, Healthcare Marketplace. Please wait. An ironic request, perhaps, considering House Republicans are demanding a delay of the plan. CNN chief medical correspondent Dr. Sanjay Gupta is live from the CNN Express in South Carolina. That's a state where about a fifth of the population is uninsured. Sanjay, the Obama team, they've had years to prepare for this day. What is up with the tech issues?
You know, it's funny, Jake, because on one hand, they thought that maybe not that many people would be coming to the site on day one. And instead, you have tons of people coming, and I think as a result of that traffic, they've had these issues. There's about 36 states out there, Jake, as you may know, where the federal government is running the exchange on behalf of the states. We're hearing about 2/3 of them had significant problems today. We tried getting on ourselves to many different states' exchanges, their marketplaces, and had difficulty. So it could be that there's been a lot of interest in this, keeping in mind, of course, you got 6 months of open enrollment, so these people are going to have plenty of other chances.
It just seems like we've known this was coming for years, and the Obama team was out there hyping it October 1st. Everybody should sign up. You'd think that the software would be there and better prepared. But moving on, explain for us how the site is supposed to work when it does work. What kind of coverage can people get if they go on and successfully get through?
Well, we looked at this pretty carefully, and I think there's a couple of things. First of all, you get in and you're basically asked to apply, to register, and as part of that you fill out a 3-page application. And I think that application is probably most notable for what it doesn't ask you versus what it does. It doesn't ask you anything about your medical history. Very important point, right, Jake? I mean, this is the crux of the issue. They don't ask you about your medical history because they're not using that as pertinent information to determine your premiums. They don't discriminate based on pre-existing conditions. That's a very important point. Beyond that, they sort of have these tiers of coverage, which are the same sort of tiers that anyone who's ever been able to purchase insurance before knows about. In this case, it's bronze to platinum. With bronze, you're paying lower premiums, but higher copays, higher deductible. With platinum, higher premiums, but lower copay, lower deductible. So very simple. If you think you're going to go to the hospital a lot, you have medical issues that require that, you probably want to pay a higher premium and not pay as much for copays each time you go. And you just choose a plan within that. That's basically how it works.
And I know this is a huge generalization, Sanjay, but how much in general can people expect to pay?
Well, so keep in mind that, you know, the 17% number, by the way, that you quoted, that people who say they are in favor of this or they like this, that seems to coincide pretty well with the percentage of people who are uninsured in this country, about 45 to 50 million. So no surprise that 17% number, but they are also people who are most likely to be going to this marketplace. They're also people who probably have not had insurance before. They've not either been not able to afford it, or they have some sort of pre-existing condition. If you look at that population, you factor in subsidies, possible Medicaid money depending on the state, then 6 out of 10 people would be paying about $100 a month, $100 a month or less for their premiums. Now that's a lot that I've just thrown at you. Again, it takes into account subsidies, takes into account a very specific population here, but that's the number that we're hearing. We're going to keep close tabs on that number to see if that's in fact true.